Hi everyone, it's Julie from hopingforbaby.com, and you just saw me get the injection, HCG injection. I had the 10,000 units. Your units might be different from mine, but that was a very rushed example of how to do it. Like I said, it was the first time I ever did that. This is my first round of IVF. I think one thing I would have done differently is I would have given myself a little bit more time to prep. What time did we start? We started at 10:08 and I was supposed to give myself the injection at 10:15 just because it did feel kind of rushed. So I wanted to go over the steps that you didn't see in the video because I didn't want to show my ass to the world. So because the target for the shot it's not really on my ass, it's like above it. What was missing was cleanse the injection site and upper outer quadrant of the backside hip. It's a nice way of saying above the butt. Usually they'll like circle in permanent marker where it's supposed to go, and if they don't, ask them if they can, because it's a very specific spot. After you use the alcohol prep, wait a few seconds until the alcohol has dried on skin. Remove the cap from the needle. Insert needle quickly in a dart-like motion 90 degrees to the skin as far as it will go. And in the instructional video, so like if you have a little curve, instead of going like straight like that, you kind of have to go with the curve at 90 degrees, if that makes sense. So quick and all the way in, basically. Anchor the syringe with your free hand. Pull back slightly on the plunger, so you're pulling back a little bit to see if there's any blood. And if there is blood in the syringe, then you need to take it out and then re-inject in an alternate area. And she told me within an inch of that area, so don't go like way far out. If there is no blood, inject the medication slowly. So you're putting it in quick and you're injecting it slowly. Withdraw the needle at the same angle at which it was inserted. Apply pressure at the injection site with the gauze or tissue. And then dispose the needle and syringes carefully in an approved sharps container. Do you have any questions for me, Mom, my lovely assistant, who helped me with the shot because I didn't trust myself to give it to myself? It's kind of hard to do it from the back, and especially the fact that you have to do it quickly. I just wanted to make sure it was done right. So I told Mom to not hesitate, and I gave her the quote from The Doors, "The time to hesitate is through," as inspiration, so just go for it. So, Mom, do you have questions for me?
So I'm curious how you feel now.
It doesn't hurt right now. It stung a little bit when the medicine was actually going in. It doesn't really hurt, like I'm actually touching on it and it doesn't hurt, but that doesn't mean it's not going to hurt the next day. The doctor was saying that it's kind of like with any shot, like a flu shot, you might feel a little stinging the next day, it might be a little sore, but I think because the needle was so thin, it didn't hurt as much as I was expecting. It was the same length as the mixing needle, but the thickness was different. The one that actually went in was thinner.
That was good, because I was afraid I was going to hurt you.
No, it's fine.
Okay, so now that that's done, the trigger's done, maybe you can explain what happens next. Like,
Okay.
do you have to do something tomorrow morning?
Yep. So they told me that I need to take my pregnancy test with my first pee in the morning. So it says, perform home pregnancy test in the morning after your HCG injection to confirm HCG absorption. The pregnancy test should be positive or faint positive. So remember, whenever you take a pregnancy test, even if it's super, super faint, that's still HCG present in your system. If the pregnancy test is negative, please call the clinic immediately. You will be asked to come in for a blood test to confirm whether an additional dose of HCG is needed. Some of the tips I'd recommend would be give yourself a little bit more time than I did, like maybe definitely more than 5 minutes to prep. At least have everything on the table ready to go 5 minutes ahead of time. Definitely want to watch the instructional videos a couple times. So we did it intramuscular, and for me that was on the backside, which is different from when you do it in the stomach, but that was specific to me. It might be different for you. Can you think of any other questions as far as the trigger shot?
The timing of your procedure sounds like it's very important.
So yeah, this shot had to be given exactly at the time that they told me to take it, because they have me scheduled. So because the appointment time is specific, it has to be an exact time that we did that. That's why it was so rushed. Like we had to do it right then.
Right.
On the
trigger
dot.
time is set by your appointment time.
Yeah, the surgery time.
The time of the trigger is set 36 hours prior to your appointment of the retrieval.
Right. Yeah.
So then it becomes very important not to follow this specific video, but to be very in tune to your clinic and to your nurses and doctors, and to follow all the information that you get from that clinic.
Yeah, take this example of a trigger shot as something specific to one person. So the dosage, where it was done, the time it was done, everything is specific to me. But I wanted to show an example of what it's like. So like your medicine might be something different. It might not be this specific type. And, go over step by step the paper instructions. If they give you a video, go over the video instructions, ask them all the questions ahead of time. And we sat there and we asked at least half a dozen questions? Yeah, so just ask a lot of questions. But yeah, this is just my example, and I wanted to share it to the world.
And if there's anything that they're unsure of, call the clinic back. Don't double guess. I mean, this is your life, your baby.
Yep.
So.
Truth. So now, how do you feel if I turn the camera on you and ask your experience in this? So Mom was nice enough to do the trigger shot for me. Tell me what you think of this whole trigger shot. Specific to the trigger shot. We can talk about the other stuff in other videos.
I think we were lucky to get it right on time, even though we were a little bit rushed. Our time was 10:15 and the shot was given right at 10:15.
Good job, Mom.
So I think we were real lucky that we were able to do that. So.
Did you feel a lot of pressure?
Yes, I didn't want to hurt you.
Oh, it probably didn't help that I was like, clear the table now. We gotta do this now. We were eating our salads, being healthy. And I was like, okay, get everything off the table. So you felt a little pressure as the injector?
Yeah. Well, I'm just happy I was here to support you and help you with this.
Yeah, thanks, Mom.